Last type of anemia is vitamin deficiency anemia. It is a lack of healthy red blood cells caused when you have lower than normal amounts of certain vitamins. Vitamins including folate, vitamin B12, and vitamin C. Vitamin deficiency anemia occurs when you don't eat food that contains the listed vitamins, or when you have problems in absorbing vitamins. Vitamin deficiency anemia can be corrected with vitamin supplements given by your doctor and changes in your diet. Next slide. Signs and symptoms may include fatigue, dizziness, pale or yellowish skin, irregular heartbeat, weight loss, numbness or tingling in your hands and feet, muscle weakness, personality changes, unsteady movement, mental confusion, or forgetfulness. This disease can develop over several months to years. Vitamin deficiency signs and symptoms may be subtle at first, but they increase as deficiency worsens. Next slide. One of the major causes when your body has a shortage of vitamins needed to produce enough healthy red blood cells. If your diet lacks certain vitamins, vitamin deficiency anemia may occur, or if you can't properly absorb vitamins, also it may occur. Causes included. Next slide. One of the causes is folate deficiency anemia. Folate or vitamin B9 is a nutrient found mainly in fruits and leafy green vegetables. A diet lacking of these foods can lead to deficiency. Deficiency can also occur if your body can't absorb these vitamins due to a problem in your small intestines. You have had a large part of the small intestine surgically removed, you drink excessive amount of alcohol, you take certain prescription drugs such as these for anti-seizure. Also, pregnant women or breastfeeding have a high risk of this disease because they need a high amount of folate. Next slide. Other cause is vitamin B12 deficiency anemia. It can result from a diet lacking in vitamin B12, which is found in meat, eggs, and milk. The most common type of vitamin B12 anemia is pernicious anemia, which is caused when your immune system mistakenly attacks the stomach cells that produce intrinsic factor. This thing has an important role in absorption of vitamin B12 in the intestine. Without intrinsic factor, vitamin B12 can't be absorbed and leaves your body as waste. People with endocrine-related autoimmune disorders, such as diabetes or thyroid disease, may have an increased risk of developing pernicious anemia. Next slide. Vitamin deficiency anemia can occur for other reasons other than the intrinsic factor. This may happen if you've had a surgery to your stomach or small intestine, you have an intestinal disease, you've ingested a tapeworm from eating contaminated fish. The tapeworm saps nutrients from your body. Last cause is vitamin C deficiency anemia. It develops if you don't get enough vitamin C from foods you eat. Deficiency can also be possible if you have problems with absorption, for example, smoking. Cancer or chronic kidney disease can also increase your risk of vitamin C deficiency anemia. Next slide.
This is mine.
No, it's mine. There are factors that can affect your body's vitamin stores. Your risk of vitamin deficiency is increased if your diet contains little or no natural vitamin food sources, such as meat, dairy, fruits, and vegetables. Vegetarians and vegans may fall into this category. Consistently overcooking your food can also cause vitamin deficiency. And if you are a woman and pregnant, you are at risk of increase. Your risk is increased unless you are taking supplements. Next slide. Also, risk factors, you have intestinal problems or other medical conditions that interfere with absorption. Abnormal bacterial growth or surgeries in your intestines can interfere with vitamin B12 absorption. You have alcohol interferes with the absorption of vitamin C, folate, and other vitamins. You take certain prescription medications that can block absorption of vitamins, such as anti-seizure drugs and drugs that is used to test type 2 diabetes may interfere with vitamin B12 absorption.
Complications. When you're deficient in vitamins, you increase the risk of having health problems, such as pregnancy complications. This is in women. If there's vitamin deficiency, there are going to be lots of complications regarding pregnant women. Nervous system disorders. I'm going fast because we have no time left. Nervous system disorders, where if you don't have enough vitamin B12. If you have a vitamin B12 deficiency, you end up with nervous system disorders. Scurvy. Vitamin C deficiency can lead to scurvy. Signs and symptoms of this rare disease include bleeding under the skin and around the gums. We don't have time. Hopefully, we'll talk about it.
You can bear with us just a little more.
Okay. Prevention. How can you prevent vitamin C deficiency? Vitamin deficiency? Well, basically, eat vitamin. Easy as that. We had an assignment of you researching vitamin-rich foods, such are dark green leaf vegetables such as spinach, nuts, enriched grain products such as bread, cereal, pasta, and rice, fruits, and fruit juices. Prevention. These are also good food for vitamin B12, so specific vitamin, eggs, fortified foods such as breakfast cereals, milk, cheese, yogurt. You guys did well on the assignment, so there's no need to talk about it a lot. Vitamin C, it's broccoli, citrus fruits, juices, strawberries, green peppers. Good vitamin. Most adults need these daily dietary amounts. You need each vitamin needs this amount daily to be good, to have a healthy vitamin level. Pregnant women may require even more of this. Consider multivitamins to preventions. This includes supplements. Don't smoke. Prevention. Don't drink alcohol. And that's it.
Yeah. Okay, thanks for your attention. Thanks for bearing with us. Here's the end of the presentation.